Hi everyone. It is Tuesday at 3:30 Eastern Time, which means it's time for another Ready, Set, Go webinar sponsored by HUD's Office of Special Needs Assistance Programs, or SNAPS. My name is Mark Allison and I work at the Center for Social Innovation, and I'll be moderating today's webinar. On behalf of SNAPS, welcome and thank you very much for joining us. Today's webinar topic is Continuum of Care Checkup, Next Steps. Next slide, please. We're lucky to have a number of national experts presenting today, and I'd like to tell you just a bit about their backgrounds. Kevin Kissinger is the team leader for technical assistance at HUD's Office of Special Needs Assistance Programs. He also is on the Emergency Solutions Grants Program team, specializing in IDIS and the Consolidated Plan. Kate Lyons has been with ICF International for a year and a half, providing support to HUD's SNAPS office. Before working at ICF, she worked in the nonprofit field for 16 years, where she managed homeless programs, including housing and supportive services. She was the Chief Operating Officer for the CoC and HMIS lead agency for 3 years in Houston, Texas. And Daniel Wildcrest is a lawyer for Home Base, where she specializes in discharge planning and capacity building. Prior to joining Home Base, she worked with a number of nonprofits where she specialized on issues of gender equity. We also have 2 expert resource advisors with us today. Patrick Wigmore is a Senior Program Manager in the Corporation for Supportive Housing's Consulting Group and has extensive experience with continuums of care, working with groups across the country. And Celesta Palmer, who is a Research Assistant on ICF's Homelessness Team. She has worked on the CoC Check-up as well as the materials being developed in support of the new HARTH regulations. Next slide, please. Before we get started with the presentation, I would like to make a few logistical announcements. Today's webinar will last 1 hour. The webinar is being recorded, and the recording and the PowerPoint presentation will be posted on the HUD Homelessness Resource Exchange website next week at the address on your screen. So don't feel like you have to scramble to take notes of every word of the presentation. For the audio, we recommend using your telephone and not your computer for better sound quality. If you experience any technical difficulties seeing or hearing the webcast, first try logging out and then back in, and that usually does take care of it. Also, you can request technical assistance at any time during the webcast by using the questions box. As always, your phones will be muted. Next slide, please. Since your line will be muted, you won't be able to ask questions verbally, but you can submit questions using the toolbar, and one of our resource advisors will do their very best to address your question. If they aren't able to respond to your question, or if you think of something after the presentation has ended, you can always go to the help desk at the address on your screen. Next slide. Once again, you'll be able to find this presentation and a wealth of other information on the HUD HRE website. Now, without further ado, I'd like to go to our first presenter, Kevin Kissinger.
Well, thanks, Mark, and good afternoon, everyone. I should mention, too, that these slides are currently posted on our Homelessness Resource Exchange, so if you haven't got there and want to print a copy while you're following along, those are up there. You just go to www.hudhre.info, and there's a link that says Ready, Set, Go webinars, and you can navigate from there. So welcome, everybody. We're offering this webinar to help everyone understand the next steps in the continuum of care checkup process and to introduce you to the checkup reports and tools that can be used to help with the continuum planning and assessment process. As a quick reminder, the continuum of care checkup is a culmination of nearly 2 years of work that started after the passage of the Homeless Emergency Assistance and Rapid Transition to Housing Act, otherwise known as HARTH. And as we now all know, the HARTH Act represents the first major change to the McKinney-Vento Homeless Assistance Act since the early 1990s. HUD has been working very hard since the passage of HARTH to develop implementing regulations and guidance. You finally started to see some of the regulations, the interim Emergency Solutions Grant regulation, a proposed HMIS data standards, a final definition of homelessness, all have come out, since December. And we've had several webinars on some of these items, and we have a lot more webinars and user guides and other technical assistance products coming out. So be sure to, continue to monitor the Homelessness Resource Exchange. Back to the checkup, we have designed it to help continuums determine their current capacity and performance and the degree to which they're prepared for HARTH implementation. It's really intended to help continuums help themselves. So it's fundamentally a self-improvement process. HUD does not have access to any individual continuum's results from the checkup. So HUD can't see an individual continuum's results, nor will information submitted during a checkup be used by HUD as part of the annual continuum of care competition. All we're going to do is see results in aggregate, but not at the individual continuum level. So this is your process. Please take advantage of it to further improve your continuum's work to prevent and end homelessness. As of this morning, we now actually have 334 out of 432 continuums that have started the self-assessment process using the online tool located on the HRE. So more than 75% of the continuums in the nation have started this process. According to Kate, who you'll be hearing from in a minute, over 2,204 stakeholders have completed surveys as part of the self-assessment process, and we have an additional 2,600 stakeholders across the nation that have started completing individual surveys. The checkup helps continuums rate their proficiency across various indicators, examine trend data contained in the Homelessness Data Exchange, and helps them establish a continuum of care action plan to guide capacity and performance improvement. The assessment results obtained through the checkup will create a baseline against which your continuum can measure progress from year to year. Additionally, starting next year, continuums that request technical assistance from HUD will be required to have completed this checkup. So the checkup results and the continuum of care action plan will serve as a starting point for any HUD TA. Fundamentally, HUD believes that preventing and ending homelessness requires effective and efficient local systems of care that allow individual providers to work in cooperation toward common goals. With the passage of HARTH, local and statewide continuums are now formally recognized as systems of care for the first time, and if funding appropriated by Congress allows, in the future there'll be federal funding through the Continuum of Care annual competition to support the administrative and related costs of operating a continuum of care. For the time being, though, there's still a need to prepare for HARTH and redouble our efforts to address homelessness. So the checkup provides continuums with a way to look at capacity and performance now and set a course for future capacity and performance improvements going forward. Next slide, please. So in this session, you should learn the next steps in the continuum of care checkup process. You'll also learn how to access and use 4 items. Number 1, the continuum of care checkup self-assessment report. Number 2, the continuum of care data profile report from HUD's Homelessness Data Exchange, otherwise known as the HDX. Number 3, self-help tools. And number 4, the continuum of care action plan template. And finally, you should learn how to enter the final continuum of care self-assessment ratings and the continuum of care action plan into the HUD HRE CoC Check-up portal. And, you know, I feel like I suddenly need to award some fabulous prizes if you can count the number of times we're going to say continuum of care in this presentation. So start counting now. All right, next slide, please. So this presentation is designed to introduce continuum of care leads and key continuum of care stakeholders to the continuum of care checkup process. We'll provide an overview of the continuum of care checkup, including its purpose, what the checkup process entails, and how continuum of care leads and stakeholder respondents navigate the self-assessment tool. This information is meant to complement the instructions that were emailed to continuum of care leads and key continuum stakeholders who have been invited to complete the self-assessment. Next slide, please. So the continuum of care checkup started last November 10th, 2011, and will end in early March of this year. The slide you see now shows the time frame for stage 1, the continuum of care stakeholder assessment. That's the stage we're in now. Continuum should be working to complete the stakeholder assessment stage by January 20th. HUD extended the original deadline from January 13th to January 20th and adjusted subsequent time frames to provide continuums with some additional time to complete the self-assessment. The online assessment tool will close at 11 p.m. on January 20th. Next slide, please. So I just spoke about stage 1. As a reminder, there's actually 3 steps to the continuum of care checkup process. The first one is what we just talked about, the stakeholder assessment. Stage 2 is review of stakeholder assessment and continuum of care data. And stage 3 is the final self-rating and the continuum of care action plan. Next slide, please. So when the online self-assessment tool closes this Friday, continuum of care leads will be able to generate a report that summarizes all the stakeholder responses. This report should help a continuum identify the areas in need of improvement as well as the areas that you're doing well. Continuums will also be able to access a continuum of care profile report in the Homelessness Data Exchange. This report will include tables and graphs of the housing inventory count, the point-in-time count, and annual homelessness assessment report data. Additionally, on Friday, HUD will make available tools and guidance on how to interpret the self-assessment survey results and the data from HUD's Homelessness Data Exchange. We're reviewing these things today. Also during stage 2, Continuum should review stakeholder self-assessment ratings and the HDX data and then use this information to do 2 things. Determine the final self-assessment rating for each self-assessment indicator and establish a continuum of care action plan. Next slide, please. Stage 3. On March 5th of this year, the online self-assessment tool will reopen to allow continuum leads to enter their final self-assessment rating and enter their continuum of care action plan. Once these steps are completed, participating COCs will be able to request HUD-funded technical assistance. Continuums will have until March 16th to enter their final ratings and their continuum of care action plan. You've got about a little less than 2 weeks. As we indicated earlier, this checkup process is intended to help continuums help themselves. We won't look at individual results, nor will the information continuum to submit for the checkup be used by HUD as part of our annual continuum of care competition. So at this time, I'd like to hand things over to Kate, who will walk through the reports and tools that will be available to you starting this Friday.
Thanks, Kevin. Welcome, everyone. In this next section, we'll walk participants through the process for accessing reports and self-help tools. Next slide, please. Okay, so individual stakeholder self-assessment responses will be kept confidential. We want to say that over and over again because we want people to feel comfortable to give any kind of answer they feel they needed to give. COC leads will not be able to see individual assessments from local stakeholders. Rather, all responses to the survey will be de-identified and aggregated before they are shared with other COC members or HUD to ensure participant confidentiality. The COC lead will see each indicator and the average score for all respondents. Next slide, please. This is the COC lead login screen that COC leads see when they select the CoC Checkup under the Request TA tab on the Homelessness Resource Exchange homepage. After the checkup closes on Friday night, leads can log in the same way they did to access the respondents page and the COC lead survey. All leads should be familiar with this page by now. Next slide, please. On January 21st, after the assessment phase closes, the Reports button will become active. Under the Reports button, there is a link for COC leads to select that will generate the COC summary and detail reports. The report will be in a PDF that can be saved to your computer and printed. Both the summary and detail report will be in the one document. Please note that the report is quite long. The total report is approximately 115 to 120 pages, and that's beginning with the 7-page summary report that's at the beginning. There is another link under the Reports button that will remain inactive until the final self-rating is completed, and Danielle will be telling you later about this final self-rating. Next slide, please. This is a sample of what the report looks like. The number and type of respondents is listed at the beginning of the report. Below that is the summary report. Each COC will receive a summary report that identifies the 5 highest rated indicators and the 5 lowest rated indicators that were scored on a 1 to 5 scale in each domain. The report you see here is an aggregate of all respondents across the country. Next slide, please. Here is a screenshot of the detailed report. Each indicator is shown and the average for the respondents is given. You can see here that the detailed report will list all indicators. The scaled indicators will have the average for all respondents, which is what you see here. There will be other, for the yes and no and unknown indicators, we will be giving the percentage for each answer that was given by the respondents. And for the indicators where there was a pick list, as in indicator 2.1.1.8 that asks if the strategic plan includes leveraging of other HUD funding, as in HOME, CDBG, NSP, and HOPWA. The percentage of each type of funding checked will be shown on the report. Next slide, please. Additional information to use in your review will be provided in the HDX. The COC profile is a consolidation of the information that the COC reported to HUD over the last several years. The information will include data compared from year to year and graphics for the COC to use in conversations with stakeholders. Next slide, please. So this is what you'll see when you go into the HDX. COCs can access this profile report by going to the HDX and clicking on the Reports tab. Next slide, please. After doing that, it will bring you to this page where you will click on the CoC Profile Report. Next slide, please. And this is where you will see, after clicking CoC Profile Report, and you can click there to get your HDX community profile. Danielle will now discuss the review tool and next steps.
Thanks, Kate. We will now return to the CoC Checkup located on HUD HRE to talk about other tools that will be available to help you when reviewing your reports. At the CoC Checkup homepage, CoC leads and other stakeholders can access the new CoC Checkup self-help resources. These resources include the CoC Checkup Review tool, which includes critical questions for your continuum, a crosswalk of CoC Checkup and HUD HRE resources, where HUD HRE resources are listed by the CoC Checkup domain and element, and finally, the CoC Checkup Action Plan, which we're going to be discussing in a minute. Next slide, please. In Stage 2, COCs should review their self-assessments results with the CoC lead decision-making group. This tool can help lead conversations with the primary decision-making group and stakeholders in your community. Stakeholders can discuss the meaning of the data and decide whether the self-assessment results really reflect reality. The tool has tables and questions to help continuums analyze their data. The table in this screenshot consists of questions from the checkup from Domain 1, which covers the COC's governance and structure. You should list the average score in the column on the right. Next slide, please. This slide gives an example of the kind of questions that continuums may want to consider when reviewing the data. The questions are helpful when you meet with your stakeholders. For example, if the CoC has a process for ensuring stakeholders have an opportunity to provide input into the decision-making process, and yet the self-assessment score in this domain is low, stakeholders should discuss why respondents did not rate it higher. You might want to consider if there's a lack of communication about the process, or do stakeholders feel that the current process is weak. Once the lead decision-making group discusses the data, they should come up with their final self-ratings for each indicator. This final self-rating should represent the most accurate reflection of how a continuum views itself on any given indicator. In the example that I just gave about the process for ensuring input in the decision-making process, if some stakeholders simply did not know about the process until the self-assessment results were discussed, then the CoC could increase its score for this indicator And then consider CoC action plan steps that help orient members to the process of the continuum that are currently in place. Next slide, please. After the CoC lead completes the review of the data with the primary decision-making group and the other stakeholders active in the continuum, they may determine that the average scores are not really reflected on the continuum. To give the continuum the ability to reflect this, the CoC lead should go back into the checkup and complete another survey. The final self-ratings may be the same as or different than the aggregate ratings from stakeholders. It's up to each continuum to determine how to come up with the final self-ratings. When the continuum checkup self-assessment tool reopens on March 5th, the CoC lead will enter their final CoC self-ratings for each checkup indicator, as well as a CoC action plan. Each CoC should enter their final ratings and action plans by March 16th when the checkup closes. Next slide, please. To complete the final self-rating, CoC leads will log back into the system. Select Final Self-Rating tab on the CoC lead portal assessment page. Then, enter the rating decided upon during the discussions with the stakeholders in your community. And after you've completed the self-rating, you can go back to the CoC lead portal page and print out the report. Next slide, please. After the final self-rating is completed, the CoC can begin the CoC Action Plan. CoC action plans are intended to identify CoC goals and action steps that are most relevant to the continuum. In some communities, the action plan may serve as an update to an existing plan, or it may serve as an altogether new plan that guides continuum performance and capacity improvement. To the extent it's appropriate, the CoC should link the continuum action plan to the federal strategic plan goals and the HEARTH performance measurement goals. Next slide, please. As a reminder, the performance measurements set out in HEARTH include reducing average length of time homeless, reducing returns to homelessness, improving program coverage, reducing the number of homeless in a community, improving employment rate and income amounts for folks experiencing homelessness, reducing first-time homelessness, and preventing homelessness and achieving independent living and permanent housing for families and youth defined as homeless under other federal statutes. Next slide, please. It's up to each continuum to determine the format they desire to use for an action plan. The template provided by HUD is only suggested. Here's a screenshot of that template. This screenshot gives an example of action steps identified to address veteran homelessness in a continuum. The strategy is to improve collaboration with the local VA. There are action steps included, the person and or organization that's responsible for each action step, and the timeline to implement the action step. The template also has an area where you can add the CoC checkup element that the strategy is related to, the alignment to the federal strategic plan, and alignment to HEARTH performance measurements. Whether you use the template provided by HUD or another format, CoC leads will be asked to upload the CoC action plan into the CoC checkup. Next slide. To upload the action steps, CoC leads will go back to the CoC lead portal and click CoC Action Plan. That will bring you to a page where you can upload the document. As Kevin stated earlier, this information will create a baseline against which your CoC can measure progress from year to year. Next slide, please. Once the CoC checkup tool is closed this Friday, CoC leads will be able to generate an aggregate report using the CoC lead portal. From January 20th until March 5th, CoCs should review the assessment results and HDX data, determine the final self-rating, identify areas most in need of improvement, and establish a CoC action plan to make those improvements. On March 5th, the CoC Checkup Self-Assessment tool will reopen, allowing CoC leads to enter their final self-ratings for each checkup indicator, as well as their continuum of care action plan. Each CoC should enter their final ratings and action plan no later than March 16th, when the checkup closes. Next slide. And now I'll turn it back to Mark.
Thanks, Danielle. I really appreciate that. We really jammed through that presentation quickly, and so we have some time, and we've been monitoring the questions that have been coming through the toolbox and the resource advisors, and there are a number of COCs that would like some more information about, what if they haven't started yet, what about the timing, what happens if they miss the deadline on January 20th. And so I'm wondering if Kevin or some of the other presenters would like to address that in more detail.
This is Kate, and I'll go ahead and answer that one. We are closing the tool on January 20th at 11 p.m. If you have not started the process, please contact your field office and ask them what you can do to get back into the checkup. We want to stress that it's an important tool and that this is your tool to use to increase your capability and capacity in your community. And so we highly recommend that everyone use it, and we don't want to just say, sorry, you can't do it. So please contact your field office, and they will then give you the information of how to keep going.
This is Kevin, Kate, if I can add on to that. There's no penalty. If the continuum out there doesn't do the checkup, there is no penalty other than it's a condition for getting technical assistance. So if you're worried that we're going to monitor you or something, don't worry. There's not a penalty other than not getting to have TA. If there's some rare instance, I would encourage any continuum that hasn't started to at least get in the system and get their stakeholders there. And if you speak with your field office, give them my name if you have any concerns about being able to finish up by then. There might be a few exceptions where we can do some things on a case-by-case basis, but in any case, we'd want to see that you were in the checkup, at least had logged in and distributed the stakeholders to the surveys.
Great, thank you. Did one of the presenters also want to talk a little bit about any coordination with emergency solutions grants programs or kind of any overlap there in the COC checkup?
This is Kate again. I'll go ahead and talk. So HUD is encouraging and requiring COCs and ESG to coordinate in their communities. There are some questions in the checkup that really hit on that, and we've been getting a lot of questions in the help desk stating that there may be a continuum of care and there is no providers that receive ESG funds. What we are doing is when we're answering that question, and it's gone to so many people that we would like to say it on air, that if you're in a community, a small community that doesn't get ESG directly, your state does get ESG. And so you should be coordinating with your state ESG representative. Kevin, is there anything else?
No, I would just pay attention to the ESG interim rule that went into effect earlier this month and look at the specific areas listed about what you're supposed to coordinate around. For one interesting one from the continuum point of view, probably would be that you actually get to, you have to work with the ESG recipient to actually evaluate how ESG funds are being used.
Excellent. So we were so efficient with our time, that'll give everybody a half an hour extra to go ahead and start the COC checkup if they haven't already. I did want to just say a few remarks to end. I wanted to thank our panelists today and also everybody on the line for your participation and for taking part in the COC checkup. It really is a useful tool, I think, for communities. As one more reminder, if you have additional questions that come up afterwards, you can submit them to the HRE Help Desk. Go under Ask a Question tab and select the Virtual Help Desk drop-down, and then you can select COC Structure, and then under Topic you can do Checkup. So it's pretty self-explanatory, and that's all in drop-down boxes. Also, as Kevin mentioned at the beginning, the webinar recording will be posted on the site, and the presentation, I understand, is already there. So if you want to refer back to that could be helpful. And please encourage all the CoC stakeholders who will be completing the online self-assessment tool to watch the recording for some additional orientation and information to the self-assessment tool. So tomorrow, keep an eye out in your email boxes for everyone who registered. You should receive an email from GoToWebinar with an invitation to participate in an online survey that tells us a little bit more about how the presentation went, and that way we can use that to improve those in the future. So please do use that link and go to that survey. And then next week we have another webinar, Introduction to the New Emergency Solutions Grants Program. And I think Kevin Kissinger wanted to say a few parting words as well. So thanks, everybody. Appreciate it.
Yeah,
Kevin?
Thanks, Mark. And thanks, Mark. This is Kevin. Just as a quick correction, our webinar schedule seems to change at the last minute, and so currently there's I think our next, we don't actually have a next webinar scheduled for ESG at this current time. It could be I'm incorrect, so so I want to thank everyone too, especially the continuum of care leads and the stakeholders who've spent your time completing the surveys and participating in the continuum of care checkup. And while HUD won't have access to reports summarizing individual CoC performance, we will receive an aggregate report summarizing CoC performance at the national level. We're going to use this data to better assess hearth readiness and help us better target technical assistance resources to help you in your efforts to prevent and end homelessness. So thank you very much, everyone, and have a great day.